Alright, so I'm checking the patient's chart. Looks like the patient needs some NTS therapy. Alright. Hi, Mr. Bear. My name is Jeff. I'm your respiratory therapist for the day. Can you please verify your full name and date of birth for me, please? I'm gloving in. Alright, perfect. Do you have a wristband? Alright, perfect. So, Mr. Bear, it looks like the doctor ordered an NTS for you. Do you know what an NTS is? No? Okay, so an NTS is nasotracheal suctioning. So basically, the doctor noted some increased secretions in your lungs. So the NTS procedure is going to go ahead and remove that secretion so that way you can breathe a lot better, okay? So let me go ahead and show you what I brought for the NTS procedure. I have a basin over here with sterile water, okay? I have some lube for the suction catheter. I have the NTS suction kit. I have a suctioning tube with a yonker, yonker. All right, so I'm gonna go ahead and connect the suction tube with the yonker. I'm gonna go ahead and connect this to the suctioning device. I'm going to go ahead and set this right by the patient so that way it's easily accessible. Just going to set this right next to you, okay, Mr. Bear? Okay, Mr. Bear, so I went ahead and took a look at your chart and your patient medication record, and it looks like you're not taking any kind of blood thinners like Coumadin or heparin. Looks like your platelets are looking good. You're not having any liver issues or anything like that. So it seems like your procedure should go smoothly, okay? If you had issues with your blood being low on platelets, and if you had been taking any anticoagulants or blood thinners, yeah, this procedure could have been really difficult because what happens in nasotracheal suctioning is sometimes the airways get nicked and bleeding could occur. But in your case, you should be good. There's no issues with your blood, like I mentioned, and also I've been doing this procedure for a pretty long time, so you should be in good hands, okay? So let's see. What I'm gonna do now is I'm gonna go ahead and take your vitals. So I'm gonna set you up in a high Fowler position, okay? I'm gonna go ahead and check your oxygen levels. I'm gonna wipe and sterilize the pulse ox probe. I'm gonna set the probe onto your finger and check your respiratory rate and your heart rate. I'm gonna go ahead and listen to your breath sounds now, okay, Mr. Bear? All right, so I'm gonna check breath sounds, 6 in the front, 6 in the back, okay? So go ahead and take a deep breath for me, Mr. Bear. Sounds good. Okay, good. 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 All right, Mr. Bear, can you sit up for me so I can check a look, listen to the back of your lungs? Okay, good. 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 So 6 times the back, like I mentioned. All right, Mr. Bear, sounds like you have coarse crackles and rhonchi in your breath, in your lungs, okay? So we're gonna go ahead and move forward with this nasotracheal suctioning therapy, okay? So I'm gonna go ahead and pre-oxygenate you right now. I'm gonna increase that FiO2. I'm gonna go ahead and set the pressure for the suctioning pressure to 80 to 120 torr. We're not gonna be needing this yonker for now, okay? So I'm gonna disconnect this. I'll leave that right there by your side for now. We're gonna go ahead and prep this basin. Add some sterile water, sterile water. We're gonna put lube on the other basin. Okay. We're gonna go ahead and open up the NTS kit. You're gonna find 2 pairs of sterile gloves in here, a left and a right. And because I'm right-handed, right hand is my dominant hand, so this is gonna be my clean hand, like my sterilized hand, okay? And my left hand's gonna be my dirty hand. So I'm gonna go ahead and start by putting the glove on my right hand, but I'm gonna be using aseptic technique, making sure that I don't get any bacteria or anything in my hands. Okay, I'm gonna go ahead and start putting my left hand now. Same thing, use aseptic technique. All right, so I'm gonna grab the suction catheter with my clean hand, my right hand, and I'm gonna go ahead and grab the suction port with my left hand. And I'm gonna go ahead and connect the suction catheter to the suction tube. Okay, and then just pretend this is actually connected. So I'm just gonna tie a knot on this. And where this knot is, I'm gonna act as if this is my suction port, okay? All right, Mr. Bear. Mr. Bear's been pre-oxygenating. I'm going to, first, before I start suctioning him, I'm going to test my suction pressure on sterile water. So I'm just gonna test this out. I'm gonna occlude the suction port. So it looks like my pressures are good. And since my pressures are good, I'm gonna go ahead and start lubing the tip of this suction catheter. All right. Okay, Mr. Bear, so before I begin, do you have any questions for me? No? Okay. All right, so I'm just gonna lift up your mask. We'll lift up your mask. And we're gonna go ahead and start this, okay? Are you ready? Okay, here I go. I'm gonna start putting the suction catheter into your nares. So now I'm putting the catheter through his nose, and as I'm advancing the suction catheter, there's gonna be some resistance, and as I continue to advance it, I'm going to eventually hit the carina, and once I hit that carina, then I'm gonna want to back up the suction catheter about 1 centimeter. And once I have it there, I'm going to start suctioning. Okay, Mr. Bear? So I'm going to start occluding the suction port. So now I'm suctioning, and as I'm suctioning, I'm going to be pulling out the suction catheter. Nice and steady, slowly. You're doing great, Mr. Bear. All right, almost done. Okay, now we got it out. It should take no longer than 15 seconds, okay? So immediately after suctioning, we need to re-oxygenate the patient. So Mr. Bear, I'm going to go ahead and apply this. Apply the oxygen back on you. Okay. So while he's re-oxygenating, he's gonna be coughing too from the suctioning. So he's gonna be coughing it off. I'm going to disconnect the suction catheter, making sure that only my right hand, which is my clean hand, is touching the suction catheter, and my left hand is touching the suction tube. I'm gonna go ahead and grab the yonker and connect it to the suction tube. Then now we're going to suction out any secretions in your mouth, okay, Mr. Bear? So I'm just gonna lift up your mask again. We're gonna suction out any secretions in your mouth. All right. All right, Mr. Bear, we're almost done. How does that feel? Did you feel like that helped? Yeah? You can breathe better? Okay, do you think we need a second pass? No? Okay. Well, let's go take a look at your vitals and listen to your breath sounds again, and just to confirm that there's no more secretions in there, okay? First, I'm going to go ahead and feel on your chest, just to want to make sure that we don't feel any secretions on your chest. All right, it's sounding a lot better. Let me go ahead and put the pulse ox back on your finger. Check your oxygenation. I'm going to sterilize the pulse ox probe again. All right, Mr. Bear. Here, it's going on his finger. I'm gonna go ahead and listen to your breath sounds again. Okay, Mr. Bear? Just like earlier, we're gonna do 6 breath sounds in the front, 6 breath sounds in the back. So go ahead and breathe for me, Mr. Bear. Okay. Good. 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 Can you sit up for me real quick, Mr. Bear? All right, perfect. Good. 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 That's 6 times. All right, Mr. Bear. Sounds like your breath sound clear now. So I think all the secretion's gone. We suctioned out a lot of secretions actually. So I think you should probably be feeling a lot better now. What do you think? Are you feeling a lot better or what? Okay, perfect. So this is a procedure that's like as needed. Okay, so if ever you feel like you need more suctioning, just feel free to let me know. Let the nurse know, let the physician know, and we'll go ahead and put in another order for you, okay? In the meantime, is there anything I can get you? Do you feel comfortable? Do you need any like pillows or blankets or anything? Or are you good? Okay. All right, Mr. Bear. Well, if there's nothing else you need from me, I'm gonna go ahead and clean up my stuff. I'm gonna go ahead and chart the information, okay? It looks like the procedure was all successful and you did a great job. I appreciate your cooperation, okay? All right, Mr. Bear, I'm gonna go ahead and clean up. Okay, so I'm just gonna clean up all my stuff. Gonna get rid of all this. Get rid of all this stuff. I'm gonna go ahead and remove my gloves. Throw it in the trash can, and that's the trash can. I'm gonna gel back out. And I'm going to chart my information. Chart. Okay. So 3 indications for nasal tracheal suctioning are visible secretions in the airways, chest auscultations where you hear coarse crackles, rhonchi, diminished breath sounds, sounds like that. And then if you hear secretions on the chest, like when you feel the chest, which is basically tactile phrenitis, increased tactile phrenitis, or yeah, that's it for the indications. And then your 3 contraindications are occluded nasal passages, nasal bleeding, and epiglottitis and croup. Okay, and 3 hazards or complications that can occur are mechanical trauma and bradycardia and hypoxemia. Yeah, that's it. All right, thank you.